things I like, well, before I start this talk, is that not only do I teach diabetic education, I too am a diabetic. I was diagnosed type 1 insulin dependent diabetic at the age of 10, and I am now 65 years of age. So I have had diabetes for 55 years of my life. I do this as part of my passion so that I can help other people that are going through some of the things that I went through as a diabetic. So when we start talking about diabetes itself, the first thing we want to do is go through our overview of what it is we're going to be discussing today. For those of you who can see the screen, we're going to talk about what is diabetes, the different types of diabetes, the importance of exercise and medication in the management of diabetes, the risk factors. You guys know what those are. That's the good, the bad, and the ugly that you hear about for individuals that have diabetes, family members, friends, neighbors. And we always remember the bad things that have happened. So we want to talk about what those risk factors are and what those complications are that are associated with the disease itself. And then lastly, in our talk, we're going to talk about managing diabetes, what the symptoms are, knowing what preventive care measures you as a person with diabetes should have, what monitoring is available to you, and last but not least, what everybody really comes to these classes for, what can I eat? So we'll discuss diet and nutrition. So let's get started. So you've been told that you have diabetes. What does that mean? For a lot of people, the first thing they think of is someone else in the family that may have had the disease, that's gone blind, or they're on dialysis, or they've had amputations, heart attacks, strokes, or even death. So many of what people think about diabetes is the worst of diabetes. And there are a lot of very technical and very complicated explanations to what diabetes actually is. So I'm going to give you a very simplistic definition of a very complicated disease. And that is diabetes is a condition of too much sugar in the bloodstream. It is our inability to take that sugar out of our bloodstream and put it where it actually needs to go. So the first thing I'm going to say is that we all need sugar. The problem with having diabetes is the body isn't functioning properly to use that sugar because sugar is the body's main source of fuel. So the key in regards to moving that sugar from the bloodstream to where it needs to go, which is inside the human blood cell, is insulin. Insulin must be paired with the sugar in the bloodstream in order to be able to pull it inside the human cell, where it is then converted through an electrical process. You guys probably remember 11th grade science, where we were all falling asleep when they were talking about the Krebs cycle. You remember that? Well, the Krebs cycle is where this takes place, and it is an electrical conversion of sugar to energy. But the problem is the only way to get that sugar inside the cell for that conversion is if insulin, which has receptors, opens up the cell and pulls that sugar into the cell. So basically what that means to you is sugar in the bloodstream is bad, but sugar inside the human cell is good. So when we talk about diabetes, there's more than one type. As I said in my introduction, I am a type 1 diabetic. Basically, type 1 diabetes means the body no longer makes insulin. Not nearly enough to survive. A type 1 diabetic is immediately insulin dependent, was generally known as being a juvenile diabetic because type 1 diabetes is an autoimmune disorder causing the body to attack itself. And this generally occurs between the age of birth and about 21 to 23 years of age. But if there is insulin production of any kind beyond that age, you are considered a type 2 diabetic. Type 2 diabetics still make insulin, they just don't make enough. If you'll imagine for just a second, if there was an exchange at the bank and you went to the bank and you handed them $1 and they handed you 3/4, you just got cheated. Or there is a deficit. Or if you handed them $5 and they gave you $4 worth of quarters, that's diabetes. You're going, what? Diabetes is the deficit of insulin to the amount of sugar in the bloodstream. In plain English, you eat or the body releases $5 worth of sugar, but you only make $4 worth of insulin. And each time there is that exchange, either the body's release of sugar or the consumption of sugar through carbohydrates, you get shortchanged because you don't make as much insulin as you're releasing or consuming in sugar. A type 2 diabetic, like I said, still makes insulin, but because they don't make enough, it creates health problems because the sugar that remains in the bloodstream actually destroys those red blood cells. And so if you think about it for just a moment, at conception, we are a single blood cell. Those blood cells proliferate or grow and multiply, which produce tissues. Those tissues then become organs, and those organs make up the organ systems in our body. If sugar that is not in the human blood cell destroys the cell, that means that sugar is destroying our cells, our tissue, our organs, and every organ in the human body. Now, there's some subsets of type 2 diabetes. Gestational diabetes is one of those subsets. Gestational diabetes is a condition in pregnant women where mama is no longer able to make enough insulin for herself and for the baby. So there's a deficit. And the sugar that remains in mama's bloodstream generally goes to the baby. So if you can imagine, your baby for 7 months is being fed sugar water, basically, or sugar blood. And therefore, women that have gestational diabetes generally have large babies at birth, anywhere from 8 to 12 pounds. And so that also predispositions that child for diabetes as well. Type 2 diabetes is hereditary. It is passed on as a recessive gene. What that means is, by virtue of the fact who your parents are, you could be at risk for diabetes. And let me dispel the myth right now. Diabetes does not skip a generation. It is a gene that can remain dormant unless triggered based on some other risk factors that we'll talk about in a few minutes. And there are other things that can trigger that dormant gene other than just gestational diabetes. There are certain medications that we take that can cause elevations in the blood sugars that cause stress on the pancreas. One of those medications are steroids. If you're a person that has had childhood asthma and took steroid inhalants, or you're a person that's had severe arthritis and had to have taken steroid injections for pain and inflammation, that constant increase in sugars in the bloodstream can put a stress on the pancreas, making you more at risk for developing diabetes. There are certain toxins certain procedures, such as radiation therapy or chemotherapy, that can destroy or hamper the development of insulin, which then makes the person diabetic. There are certain diseases that also put you at risk, such as having high cholesterol, high blood pressure, sickle cell anemia, hemophilia, as well as lupus and kidney disease. All of these can play a very significant role in the activation of that sleeping gene. And so it's important that we know, first of all, the difference between type 1 and type 2. Like I said, type 1 is autoimmune mediated, type 2 is hereditary. And there are some other risk factors that can activate that gene. So when we talk about those risk factors, we have two types of risk factors. The modifiable risk factors, and those are the things that you have the ability to change. And then there's the non-modifiable risk factors. Those are the things that can make you susceptible to having diabetes that you have no control over whatsoever. Now, those risk factors that we have the ability to change are leading an inactive or sedentary lifestyle. That's the person that only gets the exercise of lifting their fork from their plate to their mouth and back. They're not active, they're not moving, they're not exercising. That can be the person that has to sit behind a computer all day long and doesn't get up and move. Or the person that sits in their recliner all afternoon with a remote in their hand, but never bothers to get up to do something, to move. That sedentary lifestyle can lead to triggering that dormant gene. Being overweight or obese puts you at risk because that extra weight on the body causes a stress on the pancreas to produce enough insulin. Having high blood pressure can lead to diabetes. Again, we are talking about the circulatory system and the movement of blood through the body. And if the blood is thicker because of sugars and it's causing additional pressure on the movement of that blood, you can develop diabetes. So high blood pressure is a risk factor for developing diabetes, along with high cholesterol. And we know that cholesterol is body fat that is circulating in the blood. And so that excessive amount of fat causing narrowing of the arteries then can lead to high blood pressure, which can then lead to the development of diabetes. And the scary thing about those risk factors are that the number one cause of cardiovascular events in this country today are having the three risk factors. We call them the triple threat. That is having high blood pressure, having high blood fat, high cholesterol, and having high blood sugar. An individual who has those three conditions, and all of those three conditions are not managed, is basically a person that is got a heart attack or a stroke waiting to happen. Those three conditions are the number one cause of cardiovascular events in this country. Now, the risk factors that we have no control over whatsoever. Our age. As we get older, we have a natural decline in our hormone production. And insulin is a hormone. And so with the natural decline of the production of insulin and these modifiable risk factors, being overweight, having a sedentary lifestyle, having the other two conditions, that can lead us to developing diabetes. Your ethnicity and your race play a role in whether or not you develop diabetes because of the gene. If you think about it, our genetics basically come from our environment. Individuals who live in certain conditions develop certain genes. Skin tones, eye color, hair growth. Where we came from generations back is what developed our genes. If our ancestors came from the same general environment and married or mated, those genes are then passed down as a either recessive, or if you get the gene from both parents, it becomes a dominant gene. And generation after generation after generation, the genes go from recessive to dominant to recessive to dominant to recessive to dominant. And so your race and your ethnicity play a role because of the commonality of where your ancestors came from. And particularly here in San Antonio, the prevalence of diabetes, type 2 diabetes, is very high in African American or Black individuals and Latino, Latinx, or Hispanic individuals. And it is our genetics that cause the risk factors to occur. And then these risk factors are what trigger the gene. I'm hoping that makes sense to everybody. There are only 3 races in the world: white, Black, or Asian. And so based on your origin, which is your ethnicity, it puts you at higher risk for developing diabetes because of those genetics. The last risk factor is your family history. If your aunts, uncles, mom, dad, brothers, sisters, cousins, second cousins, great uncles, great grandparents had diabetes, guess what? You carry the gene. And it doesn't take but any one of those non-modifiable risk factors, along with the modifiable risk factors, to activate that gene. So for most of you on the phone for a moment, I'd like you just to think, if you have diabetes, based on these risk factors I'm telling you about right now, do you now understand why you? If you are over the age of 55, African American, overweight, sedentary job, and your aunt, your cousin, your brother have diabetes, that's a red flag to you. If you are Hispanic, living in San Antonio, and you're overweight, you're not eating well, your grandmother had diabetes, your uncle died from diabetes, you've got a cousin that's blind because they didn't take care of themselves with diabetes, you carry the gene. And so it's important that you understand the risk factors that we have, that we're born with, and the risk factors that we have the ability to change. So when we talk about diabetes, diabetes is a balancing act. Blood sugars too high cause organ damage. Blood sugars too low can cause irregular electrical impulses in the brain. In other words, seizures that can lead to death. So it is important that we know how to manage both high and low blood sugars. So it's important you know what the symptoms are, because how can you manage something you don't know, right? So the symptoms for high blood sugar are the same as the symptoms for having diabetes. Because what is diabetes? It's high blood sugar. Those symptoms include extreme thirst, urinating often, and that becomes a vicious cycle of drinking and peeing and drinking and peeing. Having dry skin, excessive hunger, blurred vision, drowsiness. Well, we're fatigued because the body's not utilizing the sugar to make energy. And you can have slow healing wounds. These are the symptoms that most people experience with the onset of diabetes. And unfortunately, for many people, they don't know that those are the symptoms of diabetes. and they ignore them or excuse them to be something else. The symptoms for low blood sugar. That is when the sugar in the bloodstream is less than the amount of insulin that you've produced. And so the symptoms that you can feel will be shaking, having a fast heartbeat, feeling anxious, like there's an overwhelming feeling of something is wrong, but I just can't figure out what it is. My body's trying to tell me something. Sweating. And when I say sweating, I'm not just talking about beads of perspiration on your forehead. You're sweating all over your body. Your hair's wet. Your clothes can be wet. For me, unfortunately, that's what happens. It looks like somebody just dumped a bucket of water on me. Blood sugars are low. That is a very dangerous sign that your blood sugars are too low. Having the extreme hunger. I once attacked a Girl Scout for a box of Girl Scout cookies just because my blood sugar was low, but that's another story for another time, guys. You can have the blurred vision. And what happens is with that flow of blood through the smallest blood vessels in the body, which are the capillaries in the back of the eyes, those blood vessels feed the optic nerve. And the optic nerve is what allows light in for vision. Well, if the blood is very thick, it causes more pressure to allow that blood to the optic nerve, which can cause blurred vision. But if there's not enough sugar, it sends irregular signals to the optic nerve, which causes blurred vision as well. With low blood sugar, you can have dizziness, you can have fainting. And if the blood sugars are extremely low, you can actually have those irregular electrical impulses in the brain, which means those neurons are firing off, causing seizures. And that can be very, very dangerous. The number one causes of high blood sugar are taking in more sugar than the body's able to make an insulin, forgetting to take your medications, not exercising, and not eating regularly. The symptoms for the causes of low blood sugar are not eating enough. Overexertion, meaning you've been told that as a diabetic, you need to start exercising, and you haven't been exercising. So today you decide I'm going to run 5 miles. The muscle tissue in the body is activated to absorb sugar with exercise. And if you haven't been exercising and all of a sudden you're going to do this 5 mile run, you've activated the muscles to absorb that sugar. And that absorption can be very, very significant. It can be more than what your body's accustomed to. And so if you haven't eaten regularly, you go out and you do these exercises, it can cause a drop in your blood sugars, leading to the symptoms that I was just talking about. Again, it's important to know that diabetes is a balancing act. You can't allow the blood sugars to get too high, and you can't allow the blood sugars to get too low. Both of them can cause damage. So how do we manage those symptoms of high and low blood sugar? Well, for high blood sugar, we want you to drink lots and lots of water. That, believe it or not, helps to dilute the sugar in the bloodstream, allowing it to be pulled into the urinary system and peed out of the body. We want you to exercise, but we don't want you to all of a sudden start the marathon. You've got to work up to that. But activity helps to burn sugar in the bloodstream by absorbing it into the muscle tissue. So movement becomes important in reducing those blood sugars. And lastly, the picture that you see says insulin. That doesn't mean we think every time your blood sugar gets high, you need to inject yourself. No, that means, did you take your medication, whatever it is you were prescribed for the management of your diabetes? And if you are not within 1 hour of your next dose of that medication, as soon as you remember to take your meds, take it. Whatever that medication is. For low blood sugar, it's a little different. We follow what is known as the 15-15 rule. The 15-15 rule says this. Step number 1, if you are experiencing the symptoms of low blood sugar, stop whatever it is you're doing. If you're mowing the lawn, if you're cooking dinner, if you're driving a car, it is important that you stop, pull over as safely and quickly as possible, because low blood sugars can lead to seizures. It can lead to loss of consciousness, which can lead to sudden death, not just for you, but someone else. So we stop what we're doing. The next step is we check the blood sugar. If the blood sugar is 70 or lower, we treat. People say, well, what if I don't have a way of checking my blood sugar? Based on the symptoms that we talked about, you assume that you're having low blood sugar and you treat it anyway. It's much easier for us to fix a high blood sugar over time than it is to ignore a low blood sugar, because it requires immediate action. Because by the time your body starts to experience these symptoms, your blood sugar continues to plummet. So you must act quickly. So step 2 says, check the blood sugar. Step 3, you are to consume 15 grams of fast-acting carbohydrates. Some examples of 15 grams of fast-acting carbohydrates are 4 to 6 ounces of orange juice, or half of a 12-ounce can of regular soda, or 5 pieces of hard candy. It can be Lifesavers, it can be peppermints, it can be Jolly Ranchers, it can be, most hard candies are about 3 grams of carbs. So 5 pieces of candy would be 15 grams. That's our first 15 in our 15-15 rule. If you don't have that, a box of raisins, an individual sized box of raisins, a tablespoon of honey, 4 packets of sugar, or 3 to 5 glucose tablets. Glucose tablets are sold in any pharmacy in the country. They do not require a prescription, and they come in different flavors. In San Antonio, glucose tablets are about $1.25 at Walmart. At CVS, they're $1.79. And there are various other places you can buy glucose tablets, but just know that they don't require a prescription to get them. There are also some other things that you can purchase. A glucose shot. I'm not talking about a shot in your arm. I'm talking about a shot like a shot of liquor, but this is not liquor, of course. It's sold in a bottle, and it is a liquid that you drink, and you consume the whole bottle. And those are about $1.25 to $1.75 at Walmart and the same various places in the pharmacy. There is also something called a glucose gel pack. A glucose gel pack contains a jelly-like substance that is pure glucose. You just tear it open. It's like in a foil envelope. You tear it open, you put it in your mouth and squeeze. That substance will be absorbed into the bloodstream and bring your blood sugars up. So once you've taken these 15 grams of carbs, the next step is to wait for 15 minutes. At the end of 15 minutes, you're going to check the blood sugar again. If it is higher than 70, then it's time to have a balanced meal. Because we don't know necessarily why your blood sugar dropped. And so by getting it to 70, 15 minutes after you've consumed some sugar, could mean that it's still continuing to drop. And we want to make sure that we get a balanced meal to help to control those blood sugars. If it is still 70 or below, you're going to repeat the first several steps by taking the other half a can of orange juice, or the other half a can of regular soda, or 5 more pieces of candy, or whatever it was you took the first time you're going to take again. You can repeat that process up to 3 times. If after the 3rd time the blood sugar is still not above 70, seek immediate medical attention. So I'm hoping that helps you to know how we treat high and low blood sugar. So when we talk about high blood sugars, there are some very, very serious effects of long-term high blood sugars. And when we talk about long-term high blood sugars, it's important that you know a blood sugar of 240 or higher consistently is the point that you begin irreversible organ damage. If you're walking around and your average blood sugar is 240 or an A1C of 10 or higher, you are doing irreversible organ damage. Some of the things that occur with these long-term high blood sugars are what you see here: blindness, kidney disease, nerve damage, amputation, heart attacks, strokes, believe it or not, Alzheimer's disease. Alzheimer's disease has now been named type 3 diabetes, which is pretty scary. The early onset of dementia and Alzheimer's has directly been associated with high levels of blood sugars because we're pickling the brain with sugar. It can lead to certain kinds of cancers, infections, fungus, bacteria, cancers, that viruses all proliferate best in warm, dark, moist, sweet environment. And what is the body of an uncontrolled diabetic? Warm, dark, moist, and sweet. So we are the petri dish for infection. By lowering your hemoglobin A1C 1 percentage point, you cut your risk for all of these complications in half. That is why your doctors are so insistent on you bringing the A1Cs down if it's higher than 7. So what are some of the things that you can do to help to manage your diabetes? 1, you should be seeing your primary care physician or the individual that is managing your diabetes, your endocrinologist, at least once every 3 months, especially if your A1C is higher than 7. You should have your eyes examined once a year, not for glasses. We're talking about seeing an ophthalmologist that looks at the back of the eyes to ensure that you're not having leaking vessels that can lead to blindness. You should have regular foot care. If you have issues with bunions, corns, blisters, ingrown toenails, your physician can refer you to a podiatrist for foot care. They can also refer you for diabetic shoes. You should have your colonoscopy at the age of 45 and 1 every 10 years thereafter until about age 80, unless recommended differently by your gastroenterologist. Females need to make sure that they are having their annual pap smear and mammogram. Vaccinations that are recommended for people with diabetes: COVID, RSV, pneumonia, flu, shingles, tetanus, and if you did not attend school in the United States as a child and did not receive your MMRs, your measles, mumps, and rubella, Those are also recommended. When it comes to testing, you need a hemoglobin A1C, which is a blood test, once a quarter or about once every 90 days. That hemoglobin A1C helps to determine the percentage of damaged red blood cells in the body. And so that test is what's telling you how high your blood sugars have been and what level of damage is being caused by those elevated blood sugars. You should have a test for your kidneys once a year. That's done with a blood test and a urinalysis. And a diabetic should be seen by a dentist no less than twice a year. Men, you have to have your cancer screenings as well, your prostate exams and PSA. And so all of these are things that as a diabetic, we need to do on a regular basis for ourselves to make sure that we're staying healthy. When we talk about foot care, I'm going to summarize this for you, but it gives you a great deal of information. As a diabetic, first and foremost, we need to keep our feet clean, dry. We need to be wearing soft socks, socks that don't cut off the circulation at the top of the sock. We should wear white socks more often than we do black or colored socks. And the reason being is visual. If you step on something and you're wearing a black sock, you could have blood on your sock, but not see it. The likelihood of you seeing something on your sock, if it's a white sock, is much higher. And that way you can address the issue. Very important. A diabetic should not go barefoot, period. Indoors or outdoors. It is too risky. And I'm going to tell you something that's going to probably shock you. But statistically speaking, San Antonio, Texas is #1 in the country for diabetic amputation. We have more people in San Antonio losing limbs than in any other city in the country. We are the mecca of diabetic amputations here. And our feet are the first to go. And so it is vitally important that we normally perform foot care. We should be examining our feet every day. Sick days. So what should a diabetic do if they get sick? Colds, flus, stomach viruses. First of all, even when you're sick, you should continue to take your diabetes medication as directed by your physician. Because one of the biggest problems when we get sick is there is a natural rise in the blood sugars. And if we don't take our diabetes medications, that rise in blood sugar basically is doing two things. It's feeding whatever the infection is, and two, it is causing irreversible organ damage. So we always take our diabetes medication. But when we're ill, we should check our blood sugar more frequently than we normally do. Now, we should always drink plenty of fluids. It's very important to maintain hydration as a diabetic. But when we're sick, it's important that we especially increase our fluid intakes because we dehydrate very quickly. And so for a diabetic, if you cannot take in solid foods, then we suggest you go to things like applesauce, Jell-O, popsicle, scrambled eggs, things that are easy to digest, low sodium soups and crackers, things of that nature. But what if you can't tolerate food at all? You guys know what I'm talking about. You don't know which end to put on the toilet because you're either got diarrhea or vomiting or both, severe nausea, abdominal cramps. what do? We still have to maintain hydration, but we also have to maintain stable blood sugars. What that means is you need to take in fluids, clear liquids, but regular clear liquid, like 7-Up, Sprite, ginger ale, green tea, Jell-O if you can tolerate it. If you can't tolerate eating the Jell-O when it's solid, drink the Jell-O while it's liquid. Gatorade, that helps to provide some of those electrolytes that your body is burning and wasting through urination. So it's very, very important that we continue to take in fluids, but remember regular fluids. So when is it time to call the doctor? Well, for a diabetic, if you have fever of 101 or higher, you need to be calling your clinic. If you have vomiting and or diarrhea for more than 6 hours, you need to be calling the clinic. You could be going into what is known as diabetic ketoacidosis because of dehydration. You may need IV fluids, you may need additional medications, you may need insulin. There may be a number of things that you need, but if you're not contacting us, we can't help you. And if the blood sugar is consistently higher than 240 for more than 24 hours, we need to contact our clinic because there needs to be something to help to get those blood sugars down, because at 240, we're doing irreversible organ damage. So let's talk about monitoring for a minute. At this point, there are a number of ways to monitor the blood sugar. The first one is a finger stick that is done with what is called a glucometer. That finger stick tells you what the blood sugar is doing at that moment. It's not telling you what your blood sugars are doing all day long. And so the finger stick gives you an immediate response. Now, the second one that you see here is called a CGM. That is a continuous glucose monitoring device. It is a device that is inserted just under the skin that reads capillary blood, that actually gives you a continuous reading of your blood sugar for 24 hours for up to 14 days. These are great because during the time that you're wearing one of these devices, you don't have to stick your fingers. But there are some specific qualifiers in order for your insurance to cover these devices. If you have Medicare, whether it's straight Medicare, whether it is a Medicare ACO, or if it's one of our Advantage plans, you need to know that in order to qualify for your insurance to pay for them, one, you have to have the diagnosis of diabetes. You can't be pre-diabetic because it's not covered by the insurance for pre-diabetics. Two, you must be on at least 1 dose of insulin per day. Or thirdly, have documentation showing that you are having severe low blood sugars at night. If that's the case, you need something that's going to alarm you that your blood sugars are low while you're sleeping, or you could drift off into a coma. But unless you have at least those 3 criteria, or 2 of those 3 criteria, Medicare does not cover the device. Now, other insurances may cover, and it's depending upon the plan itself. These devices are worn for up to 14 days at a time. They are worn specifically on the back of the arms, not anywhere else on the body. And once inserted, The next insertion is done by the individual wearing it or one of their caregivers. They are self-inserted. That means you don't go to the doctor every 2 weeks to have a new one put on. We teach you how to put the first one on, and after that, you put them on. Once it is detached from the body, whether that is intentional or accidental, it no longer functions and it cannot be put back. Which means if you run into the door jamb, or you pull it off when you pull your shirt off, or you sweat it off, once it comes off the skin, that's it. You gotta put another one on. And if you were to purchase these out of pocket without insurance coverage, you're looking at anywhere from about $925 to about $1,200 a month. They are very, very expensive without insurance coverage. And there are some benefit plans that will help to cover the cost of those, but it depends on what you've been prescribed and what your insurance coverage is. The third way we monitor the blood sugar is the hemoglobin A1C. As I said just a few minutes ago, that is the number that tells us the percentage of destroyed or damaged red blood cells in the body by sugar. And at an A1C of 10 or a blood glucose level of 240, we are doing irreversible organ damage. So, what should the A1C be? Well, if you have diabetes, the A1C should be less than 7. If you have pre-diabetes, less than 5.6. It is imperative that you as a diabetic know your A1C, because that A1C shows you the equivalence of what your walk around blood sugar levels are over the course of about 3 months. So if you are at an A1C of 10, that means 10% of your body's red blood cells are being destroyed by sugar. What is compatible with life is somewhere around 7. What the person that doesn't have diabetes sees as an A1C is somewhere around 5. If you have questions about your A1C, contact your doctor's office. Now, what we're looking for as a target range for our blood sugars at specific times of the day. For our morning blood sugar, when we first wake up, before we've had our coffee or anything to eat or drink, the goal is for your blood sugars to be between 80 and 130. 2 hours after every meal, the goal is for the blood sugar to be between 140 and 180. That's your recovering blood sugar. That means what your body has done with the food you ate and the insulin that you've produced. And your bedtime blood sugars we like to keep at a range of 100 to 140. So this helps you to understand what your blood sugars are doing. Is it too low? Are you in range? Is it too high? When is it too high? And what work do you need to do to keep them in range? We've talked a little bit about exercise, but it's important that you understand that for a person with diabetes, activity is extremely important. And it really doesn't matter what kind of exercise you're doing. It's the goal to activate the muscle tissue to burn sugar. So walking is good, swimming is good, weightlifting, tennis. I personally love to kayak. I kayak about 5 miles, 5 to 10 miles when I'm able to kayak. But that's one of the things I enjoy. I love racquetball, very active sport. But it doesn't have to be that you're in the gym 5 days a week to exercise. You can do exercises at home, sitting in a chair. Health Texas offers a class called A Matter of Balance. That class is open to our patients, and it teaches balance, strength, and flexibility. It's an 8-week course. That first half of the course, you're discussing balance, exercise, and flexibility. The second half, the second hour of that class, you're exercising. Exercising about 5 days a week for 1 hour a day, what is recommended for people with diabetes. Medications. There are multiple medications that diabetics can be put on. And there are classes of medication. The first line medication for diabetes is metformin. And metformin gets a bad rap sometimes because of some of the side effects that it can cause. Metformin is designed to do 2 things: slow your digestion and to stop the liver from excessive release of sugar. Let me go back for just a second. I said that metformin is designed to slow your digestion, allowing your body time to make enough insulin to accommodate the sugar in your food. Over 40% of the people who take metformin take it incorrectly. Metformin should be taken no earlier than half an hour before you eat and no later than half an hour after you eat, because it's designed to slow digestion. And if you're not eating and you're taking your metformin without food, it's going to cause the gas, the bloating, the nausea, the diarrhea that people experience taking metformin. I can't tell you how many of my patients say, well, I take it when I get up in the morning, and then I eat breakfast, and then I take it before I go to bed. And then I'm sick all night long, or I wake up the next morning and I've got diarrhea. It must be taken with food. Go back and check your bottle. It'll tell you to take it with food. There are other medications that a diabetic can be on. We can't go through all of those, but just know there are classes of medications. One of those classes is sulfonylureas. Those are the medicines that we take that help to pull sugar out of our bloodstream into our urinary tract so that we pee those off. There are other medications such as glyburide and glipizide. Those medications are designed to help to stimulate the pancreas to create insulin and to tell the liver, we got this, you can stop. And then you have your injectables, your GLP-1. Those medications are injected once a week. They are Ozempic, Trulicity, Mounjaro, what am I forgetting? Victoza. And those medications are designed to stimulate the pancreas. They are designed to decrease insulin resistance. And one of the positive side effects of those medications is weight loss, because it also inhibits or decreases the appetite. So consumption becomes less. Your ability to use the insulin that you do make becomes greater. And so we are seeing that people are losing significant amounts of weight when they're on these medications. And there's also another class of medications called GLP-2s. These are oral medications that do some of the same things that these injectables do, but you take those once a day instead of once a week. Rybelsus would be one of those medications. And then, of course, you have your insulins. And there's more than one type of insulin. You can have a short-acting insulin, an intermediate-acting insulin, or you can have a long-acting insulin. So when we start talking about food, diet, what does diet mean? Well, for a person with diabetes, diet should be an acronym. And that acronym stands for this: doing intelligent eating today. Repeat that: doing intelligent eating today. That means as a diabetic, we have to think about what we're putting into our body. And we have to make a decision. Is this my medicine or is this my poison? And for people with diabetes, there's very little gray in the middle. It's either good for me or it's bad for me. And so diet becomes something that we have to think about. We have to plan our meals. We can't just get to lunchtime and then decide to go through the Whataburger drive-thru and order the hamburger with cheese and order fries, a Diet Coke, and throw one of those cinnamon rolls in the bag while you're at it. That's our poison. And so we have to think about the food we're eating. So how do we eat? Well, first of all, for a diabetic, breakfast should be within 1 to 1.5 hours of waking up. That helps to stop the release of sugar by the liver. We need either 3 meals a day, about every 4 to 5 hours apart, or we need 5 small meals every 3 to 4 hours. And we should focus on eating lean meats, such as chicken and fish, green leafy vegetables. Those are our low-carb foods. The mantra for a diabetic is low carb, low fat, high fiber, high protein, and low sodium. That is how we as diabetics, basically that is how we as Americans should eat, but we don't. The foods that we need to avoid. We need to avoid enriched flour. Guys, that's your white flour. We need to avoid any food made with white flour because it is high in starch. Those starch converts to sugar. And if you think about it, white flour, we have a saying, if it's white, we don't bite, but if it's wheat, we can eat. Meaning foods high in fiber are going to be better for us than those processed foods. And white flour is processed. That's your breads, your pie crust, your cookies, your cakes, your gravies, your coating on meats. All of those, when consumed, immediately turn to sugar in the bloodstream. We want to avoid hydrogenated or partially hydrogenated oils. Those are those oils that turn solid at room temperature. And we want to avoid extra sugars and high fructose corn syrup. 1 packet of sugar is the equivalent of a teaspoon of sugar, which is the same equivalent as a cube of sugar. And in each teaspoon of sugar, there is 4 grams of carbohydrates. What that means is for every 4 grams of carbs you eat, you are eating a teaspoon of sugar. I have an example here of what we're talking about. If you consume Marie Callender's chicken pot pie, you consume 61 grams of carbs. Or in other words, you just ate 15¼ teaspoons of sugar. And I could go on and on with all of these, but for the sake of time, I'm not going to. But it gives you an idea of the amount of sugar that we take in and things that we don't necessarily realize are full of sugar. A slice of pepperoni pizza from Pizza Hut, that's thin crust. 34 grams of carbs, or you just ate 8½ teaspoons of sugar. And if you were to eat all of this food that I show here in a single day, what you consumed was over 220 teaspoons, or half of a 1-pound bag of sugar. And as a diabetic, we don't make enough insulin to tolerate that. So, dietary recommendations are, as I gave you that mantra a few minutes ago. They should be low fat and low cholesterol. That means we want lean meats, limiting our red meats. One of the sayings I tell people is the less the feet, the better the meat. A cow and a pig have more feet than a chicken and a turkey. And a chicken and a turkey have more feet than a fish, or an egg, or edamame, or mushroom, or tofu, or soy. The less the feet, the better the meat. So we want lean sources of meat. We want to avoid shellfish. Yes, that's your shrimp, your crab, your lobster, your oysters, and your crawfish. What? Oh, and mussels and clams. Why? They are high in cholesterol, and cholesterol is a problem for diabetics. We want to increase our white meat, such as chicken and fish. We want to increase our fiber. Fiber blocks the digestion of carbs. So those foods that are higher in fiber help us not to consume as much sugar. That's why we would say no white potato, but you can have a sweet potato because there's more fiber. Fruits and vegetables that we eat to skin on, with the exception of grapes, are better for us because of the fiber. We want to limit our alcohol and eliminate our trans fats. Those are those fats that turn solid at room temperature. We want low fat, low cholesterol. We've already talked about those. Our meal plan. No two people are going to have the same meal plan. Not everything works the same for everybody. No matter what your dietary goals are, you have the information that helps you to know what to eat. And what's important is the quality of the food you eat and the quantity of carbohydrates that you consume. Because carbohydrates, 100% the carbohydrates that we digest turn to sugar. We cut our carbs and our calories when we cut our portions. It is not the same as a serving. A portion and a serving can be very different. A serving of a particular food may be a cup, and a portion may be 2.5 cups. Look at a bowl of cereal. A serving would be 1 cup, but most people eat 2 cups of cereal. So we've got to cut our portions to equal our serving. So this is what your plate should look like. Half of your plate should be vegetables, preferably green leafy vegetables. 1/4 of your plate should be your protein and your meats. 1/4 of your plate is your carbohydrates. We want complex carbs. And you get about a tablespoon of fat. So we want to cut the crap. The crap stands for carbonated drinks, refined sugars, artificial sweeteners and colors, and processed foods. We want to eat more food, fruits and vegetables, organic lean proteins, omega-3 fatty acids, and we want to drink water. Limit our alcohol. Alcohol turns to sugar and it causes rebound in a diabetic, meaning it causes the blood sugars to drop and then it causes them to skyrocket. So we want to limit our alcohol to 1 drink per day for women, 2 drinks a day for men. And as you can see here, our limits are 4 ounces of wine or 1 12-ounce can of beer or 1.5 ounces of spirits. That's a shot, guys. That's 1 shot. So women get 1, guys get 2. And no, you can't save up and have a 6-pack on the weekend. Doesn't work that way. It's either you use it or you lose it. And what's important to know is, if nothing else, one of the biggest things you can do to help you stay healthy as a diabetic is to stop smoking. There are resources to help with that, the American Lung Association. There are medications that are available to help a person to stop smoking. So remember why you started this journey, and that journey is to maintain good health. Does anybody have any questions that I can answer for?
If you have any questions online, you can take yourself off of mute to ask the question or post it in the chat.
I thank you for your attention while we're getting questions. All right. How old is she? She's still young. And unfortunately, as we get older, the prevalence for diabetes becomes higher because of the things that I told you. And so the thing that she can do now is, one, try and help to control the weight. Two, eating healthier. Just unfortunately here in San Antonio, it's very difficult because one, we are the mecca of the most delicious Tex-Mex food on the earth as far as I'm concerned. But most of those foods can be very unhealthy for us. And even in enjoying some of those foods, the problem is portion. You know, we are seen as being greedy, fat Americans. And one of the reasons that we're seen that way is we're the only country in the world that eat from a platter. The rest of the world eats from a 10-inch plate, and we call that a dessert. You know, you go and you order an enchilada plate, you got 3 enchiladas, and then you got rice and beans, and everything is hanging over the sides of this plate. And that's more food than we need to eat. Any questions, Heather?
Not at this time. I don't see any.
Okay, guys, again, I thank you for your time and your attention. Please note that Health Texas, our Aetna Whole Health ACO, we do provide several different education forums for you and several classes, and we look forward to your future attendance. Thank you.